Hi, my name is Jazmine Coates, and my guest is Ryan McGraw from Access Living. Today, we're going to be talking about the town hall that has gone on at Access Living, and I would like for Ryan to start talking about what has gone on at the town hall.
So on March 22nd, Access Living did a town hall on home and community-based services. We had two panels there. DRS spoke with some staff there, and they answered some questions regarding home and community-based services. And then we had a consumer and PA panel, and they spoke about issues facing both consumers and PAs in the current system. So that's how that was a little bit how it was set up.
Okay. Who were the people that came out from the DRS, the Department of Human Services?
I don't remember them all by name, but I know the positions. But we had some area coordinators of DRS. David Kunik was there. He's the second in charge of DRS. I don't remember his position, but David Kunik works very closely with Lonnie Patrick.
Okay. Did you ask about if that the system, how the PAs were gonna get paid for helping the consumers?
So right now in Illinois and really nationwide, there is a PA shortage. The shortage is due to multiple reasons, but one of the main reasons is the low PA wages. Right now in Illinois, the wage that a PA or personal assistant makes is $17.25 an hour. you can make comparable wages at working at a department store like a Target or a Walmart, or working in a fast food chain, let's say McDonald's. And PA work is hard work. It involves getting people out of bed, feeding them, helping them with their activities of daily living. So, to really attract more quality PAs to the profession, we really need to offer not only higher wages, but benefits, sick days, vacation days, and really medical insurance for PAs to have.
What if PAs do not show up to work? How does that affect their pay?
So, if a PA doesn't show up to work, a PA would not get paid.
Or
But if, in addition, if a PA doesn't show up to work, and let's say a consumer cannot get out of bed, the person cannot get out of bed, they cannot eat, they cannot take their medicine, they are in fact a prisoner to their bed and where they lay down. So and you just can't do that to a person. And I hear that happening more often than not. And that's why it's important also to have a quality emergency backup PA program if your PA doesn't show up. You need to be able to call someone to come in hours to help you get out of bed and start your day. Because really, for some people, that's a matter of life or death if you don't get your medicine and you can't eat.
okay,
Yeah, not to mention bed sores or pressure sores.
that is true.
Do you want to know what makes Chicago great at 8? Team Chicago Challenge. For more than 37 years, Team Chicago Challenge gives you very cool information about all things motorcycles that you've been very hard-pressed to find anywhere else. So tune in to CAN TV Channel 19 this week and every week at 9 p.m. for Team Chicago Challenge for more amazing, unique, and homegrown Chicago programs.
Has the Department of Human Services said anything of how they're basically gonna look into this?
We have not talked to them since the town hall, but what we're hoping to do is bring these issues to the department with actionable items of how they can work with us. We want to have another town hall in July to have conversations with consumers of home and community-based services, and hopefully representatives from DRS will be there to be a part of those conversations. So, one of the issues that came up was PA training and the need for PAs to be trained properly so that they know what they are getting into by taking this job and what day-to-day services entail. We think it would be great to have consumers of home and community-based services at these trainings so that they can actually see firsthand what goes into a daily personal assistance job. And because often PAs quit within 2 or 3 weeks of getting a job, and that affects the person. That means they are left without a PA. And if they do not have a backup PA, then they have no one to turn to. Then they would have to go to the hiring process again, which can be long, especially with the PA shortage, which I just talked about, with low wages, with no benefits, and not only that, but the PA hiring process can take a long time. A person must fill out the paperwork of a PA packet. They must mail or take the PA packet to the DRS office. Then from there, the DRS office takes about 2 or 3 weeks to approve the packet and do a background check on the PA. Some people that just lost their PA do not have the time and luxury to wait 2 or 3 weeks for a PA. They need them to start now.
Like one of our other consumers.
So yes. And so that's important. And so it would be very helpful if there was an online system that allows PAs to send the packet over the internet. We're in 2023, and PAs need to be, it will help very much with expediency in the process. And with timesheets, a PA has to manually put in the hours in written timesheets. Then they either have to put the time, mail them to the office, or take the timesheets manually
But
over to the office.
I have a question. But when you mail the timesheets or I hear what you're saying, that get in with the get in get in the 21st century,
Yeah.
right? With trying to get everything all together and doing it electronically instead of trying to hand out, instead of trying to do it paper. Okay? But my thing is, okay, why can't the DRS workers already have that in place for whoever's PAing for that person, instead of that person have to come in and then that person having to do their timesheet and all that other stuff.
So that is why we feel it is so important to have an online portal where a PA could simply put the number of hours that they worked on certain days and click a button where it will be submitted online, and they don't have to take the time to get on transportation to take the time sheets or make out an envelope and mail them in. Takes a, it takes, it would make it much less time consuming for the PA to do the task that they're not even getting paid for. And if they're using public transportation, the process of taking the timesheet to the DRS office could take up to 2 or 3 hours.
So trying to get them into a simpler way to finish this whole process up.
Yes, and getting paid.
Okay.
And getting them paid effectively and on time.
I have another question for you. So when PAs do not show up for so many for so many days and they don't call the agency to actually let the agency know that they didn't show up for so many days, then how does that affect the how does that affect the consumer?
I mean, I think, as I said before in my previous answer, I think that if a PA doesn't show up, then the consumer can't get ready. They cannot get out of the house. They cannot do the things they need to do to be effective in life. And I think that's why it is so important to build that relationship and like have that. But I don't know what specific. So building that PA consumer relationship is very important so that does not happen. Another thing I wanted to talk about is undocumented persons in Illinois are not allowed to be on the Persons with Disabilities Home and Community-Based Services Program. This affects them in the sense that they do not get personal assistance services provided them by the states, which means that this puts the responsibility of this on the family unit or friends to provide personal assistance services to the person in an unpaid fashion. And this may mean they would lose income in some other area. Another thing is with the PA crisis, as it is in people not applying to be personal assistants, undocumented people would be a key resource to be personal assistants and may be able to fill the gap of and help with the personal assistant shortage because and another plus side of that, we have many home and community-based services consumers who speak different languages, and it is likely that these immigrants have different fluency in different language. Okay, one of the things we are working on now with the Institutional Rescue and Recovery Coalition is House Bill 3716 in Illinois, and this would provide a task force that would come up with a 5-year plan to decrease the population in nursing homes, and it would give subsidies to nursing home residents to get housing, in housing of their own. And the third part of the bill, it would give legal rights to nursing home residents if they are retaliated for reporting an incident against nursing home staff in the nursing home. This is called the Nursing Home Redirection Act. It's a very important piece of legislation in Illinois. It has is passed through the House, and House committee, we're trying to get it over to the Senate, and it is of critical importance that gets passed.
Okay.
So please support House Bill and Senate Bill 3716.
Thank you, Ryan. Thank you for coming to the DAP Productions.
Thank you very much for having me, Jazmine.